Hello, good evening, everyone. Hi, I'm doing this video because I just passed the Nclex PN exam this December 2. So I I really wanted to help students to pass in my own little way. So I gave I comment. My instructor told me to comment on UWorld and Nclex practice in Facebook. And then when I do that, ev- everybody te- message me wanting to ask me how I passed. Actually, I didn't know why I passed, but I can give you some of the my test that came out. But I know we have everybody has different questions. But for me, some of the questions, not the questions I remember, but the topics. I can give you some of the topics that I encountered. Okay, so when I took my test uh, last December 2, I took it in San Diego. Um, Good thing because when I'm trying to schedule myself here in close to me, like around LA, it's full. So I went all the way to San Diego, and then unfortunately they canceled exams here in California in Los I mean here in Los Angeles. So mine mine didn't they didn't cancel it. So I go and took my test. I don't even know if I'm ready, but I know I read my contents. You world I do my practice you world 1 week before my test. I studied my contents. That's the most important, I think, because when you know your content, I think it's easy for you. Although I'm not really sure, sometimes uh, board wants something different, like what they want. But anyway, I didn't even know what I didn't even know what number I stopped. The computer stopped because I keep doing it until I realize that I'm doing the survey already because I'm into uh, case studies. And I was so nervous because my friend told me that if you take case study, that means you failed. So, yeah, that really disappoints me after the test. And so anyway, yeah, my test went like this. Mostly, I got medications like antibiotics like doxycycline, enalaparil, uh, warfarin, insulin, a lot, calcium channel blockers, ACE inhibitor, SSRI, you have to know that. You have to know every side effects and adverse effects, as well as interventions, positioning patient also. And what else? Uh, I have all the list of my topics, or maybe answers, but I cannot tell you what the questions, how the questions was made. But I can give you the topics. I really wanted to help uh, future test taker of Nclex in my own little way. Like, if I answered all your messages uh, individually, it's gonna be hard for me. So that's why I realized I might do the videos like uh, giving you tips and advices. Also, maybe I can share what how my test went. So yeah, I have all the list here. I can read it to you. Okay, so bear with me. My test. Are you seeing me, guys? Oh my god, I'm so sorry. Wait, I don't know how to do this. Please, I don't know how to make blogs, but I'll try my best. Okay. So with this, okay, I I I made a list of my NCLEX topics that I encountered. So yeah, the I didn't I can't some of the medications I can't remember, but I'm just telling you guys to go over medications. All your calcium channel blockers that starts with LOL or PRIL, ACE inhibitors, as well as what else? Okay, so uh, for warfarin, I think there's a question there about green leafy vegetable. I don't know how the question is, but there's a question about the insulin and the glyburide oral uh, insulin or oral medication for type 2 diabetes. Yeah, I studied that. Also, study the insulin, how to mix insulin. My how to remember it for me myself is first do the NR and N first and then R and then R and then N. So NR, that means N is NPH, then regular, and then I think I start with the air N first, and then R, and then withdraw R, and then N. Okay, NRRN. And I have questions. My maternal questions is about. I don't know. I forgot about the questions about, but I do have uh, maternal. Oh my gosh. Okay, I'll go back with that. So, question about PEDS. The question about PEDS is like, I think it's about my answer. I think it's jaundice, something like that, or bilirubin. Yeah, study that. Also, cystic fibrosis. Yeah, there's a question about cystic fibrosis, so please read that. Uh, when we were in our nursing school, uh, there's something there that we need to remember about, right? For example, about celiac disease. I have question about celiac disease. What is the thing that we need to remember about celiac disease? Celiac disease is, remember, gluten. So avoid gluten. Foods with gluten. What is gluten? It's like it's the it's oh my god, it forms or shape the food, food. So avoid that, shape forming food, something like that. Okay, that's the thing I remember. You need to remember about celiac disease and what are the foods that have gluten. And remember your love values, especially like the creatinine, hemoglobin, hematocrit, yeah, mostly that potassium. Mm, what else? The most important, yeah, yeah, that those you need to remember. You need to know your normal values. Question about the answers, Bouchard nodes, and so there's a lot of delegation and prioritization. You know about the prioritization is uh, which patient should the nurse see first. Okay, so study that. You know, the prioritization, you can do ABCs, and you can also do, think about stable, unstable patient. Think about um, you don't look at when you're doing the prioritization, you don't look about uh, the severity of the disease. Sometimes the disease is uh, very light compared to the severe, you know, stage 4 of, cancer. But then, you should prioritize first somebody who has this abdominal, pain or something like that. So you have to read carefully about the condition of the patient for prioritization. Sometimes it's ABCs, airway, breathing, or sometimes it's, you have to look up from the, is it CNS, is it from brain, lungs, or stomach, so brain is more priority, right? So yeah, that's how you uh, do your prioritization. Also, you should study what's the SNS and the PNS, adrenergic SNS, and then PNS is cholinergic. Because if you know the SNS and your PNS, you will know the medications, you will know uh, from there, like the interventions and the side effects and adverse effect. If you know your SNS and your PNS, so you have to know that. You have to know that. And yeah, there's a question about Marplan, Nardil, Pardil, Marplan, Nardil, Parnate. Yeah, check those medications. I think that's Maui. You know Maui? Monoami oxidase something. Maui inhibitor. Uh, there's, I think the important for those for Maui is like avoid over the counter medications. or there's more about Maui, you know. Please, please, I don't know how to do this. I didn't even, it's only in my mind, and I just only wrote the list of what I encountered in my test. So, this is something at least it can help you. Like, maybe you will get those questions and you will get this topic. So, maybe through that I can help you a little bit. And also somebody was asking me how I studied. So yeah, I told you, like, I studied my contents. I do a little bit of UWorld and NCSB and practice test, but more on reading my contents. And also, uh, what do you call this? Yeah, that's all I do. That's what I do. And I have Saunders and I have ATI too. Little bit of, everything. You know, uh, what do you call this? I compared their um, questions and answers and rationales. What else? So study your kalemias, your potassium, hyperkalemia, hypokalemia. What's the value? Uh, what is the side effect? What to do? Just please study kalemias. Also, there's a question there about non-stress test. I just remember that I answered is to monitor fetal well-being. And also there's a question about caput succedaneum. It's a cross section, just I just remember that. But sometimes if you see the about the head, so it's gonna be cephalic. So those also there's a question about autonomy. There's a question about assault, you know, and read about those. I cannot explain each one of these. There's a question about delirium tremens. Read about the delirium tremens, and about pacemaker, what to avoid raising, I think, arms up, something like that, or no, don't carry above the head. That's for the pacemaker. This question about seclusion, about the position for a lumbar puncture procedure is like lateral recumbent, and PPEs, contact and droplet. For PPE, how there's a how to put on and how to don and then take off. I just remember when you take off the word germ. Germ means gloves, the dirtiest, right? The dirtiest gloves. I, I means the goggles. I, and then robe, and then mask. Okay, that's the germ. That's how to take off the mask, the PPE. And then uh when you don, when you put on, you just what do you call this? Do the R first and then meg. Instead, first is germ, right? When you take it off. And then when you put on is R meg. That means first is robe, and then mask, and then eye, and then gloves. Isn't it? R meg. Robe, mask, eye, gloves. And then for contacts, remember GG. GG, okay? Uh, GG, gloves and gown for contacts. Um, yeah, remember the contact precaution. Is it contact precaution or droplet? I know you know that, but droplet, you can always remember about the 3 feet distance away from the, especially if the patient is like sneezing or, uh, yeah. Also, question about uh, illusion and hallucination. Okay, when you will know if it's illusion, there's a referent. Like there is really something there, but misinterpreted by the patient. For example, uh, the patient saw uh, a hose from the wall. He saw he's like looking it as snake. So that's an illusion. But then if it's hallucination, there's nothing in there. There is nothing. He's hearing anything, he was seeing things, but there's nothing in there. There's no referent. That's the uh, differentiation of illusion and hallucination. And there's a question about diphenhydramine. I think diphenhydramine is oh my god. I have everything here, but I cannot uh, tell you each. ACE inhibitors ends with pril. Okay, whatever is that. Oh, those are uh, ACE inhibitors: captopril, enalapril, lisinopril, fosinopril. So ACE, an hour before meal, avoid salt. Cough that is dry, nagging, persistent. And then there's a periorbital peripheral angioedema. Oh, okay. And for adrenergic blocker, begins with LOL. Carvedilol, atenolol, metoprolol, propanolol. And this is contraindicated for patient with asthma. Okay. Uh, okay. So that's how yeah. Just look about diphenhydramine because there's a question about diphenhydramine. I mean, I answered diphenhydramine. And about the nitroglycerin, you need to call the 911. You need to call 911 after the first dose. For 5 minutes didn't work, you have to call the 911. Okay, so asthma is contraindicated to beta adrenergic blockers, which I told you ends with LOL medication. Okay. And also question about the stomach care, and the color of the stoma. And also remember, I think the color of the stoma is pink red, something like that, not purple. Okay, about remember, okay, so here about these are points to remember. Okay, bear with me, guys. Yeah, I'll do more when I get a chance. But this one that I'll just went over with you. Yeah, these are the test I had. There is more, but sometimes there's one. If I say like Butchered Notes, there's only one question for that. That's it. Then the answer is Butchered Notes. Okay. And there's a question that the answer is autonomy, and the answer is assault. The answer is delirium tremens. So I was giving you my answers. That means there's a question about that answer. Okay. And okay, these are things to remember about SIADH and uh, diabetes insipidus. Okay, if there's a lots of urine retained, the specific gravity is low, and that is SIADH. Low specific gravity and uh, urinary retention. That's SIADH. Syndrome of inappropriate, where is that? Antidiuretic hormone. Symptoms of inappropriate antidiuretic hormone fluid. So if it's urinary retention, that is SIADH. That means its specific gravity is low. If it's retained, but then if you have volume deficit, that is DI and diabetes mellitus, volume deficit. If it's fluid volume excess, that's SIADH. Wait, lots of urine retained. Specific gravity is low, that's SIADH. Volume deficit equals is diabetes mellitus and diabetes insipidus. And then fluid volume excess is SIADH. Okay, about insulin exercise, if the patient is doing the exercise, that means that's another shot of insulin. Therefore, the nurse should decrease the dosage of insulin because it might go lower. It might get hypoglycemic. So and also the nurse must give the student rapidly metabolized carbohydrates, snacks, or juice. Okay. There's also question about bilirubin. The normal level in adults, bilirubin is 0.2 to 1.2. But there's a question about bilirubin in newborn, about the newborns. And I think if if the baby was has elevated bilirubin, elevated level is 20, more than 20. Yeah, the doctor wants to hospitalize the patient, the newborn, yeah, patient, when bilirubin level is about 15 to 20. And also that's why the baby gets yellow, because the bilirubin is high. So lithium is anti-mania drug used for bipolar, uh, only if in manic episode. Okay, and lanoxin or digoxin is for AFib and CHF. I only choose these things because I got this question. Okay, And also, dilantin phenytoin is a seizure medication. Just remember that. I also have question regarding ECT. You know what is the uh, uh, what is the effect, the adverse effect and the side effect? I think there is the question there, and the answer is like maybe confusion, memory loss, headache. Yeah, I don't know if what I answer because there's a different question, but I answer headache. Also, yeah, I think that's it for now. And then I'm gonna make a list again for more. This is all I can remember for now. But I have to do it again. Send your questions maybe, or so, because sometimes I can't remember if uh, what to give you. But then when you ask me, maybe I can remember, I can recall those questions if I encounter that question. Okay, I'm sorry because it's like um, it's messy, and my it's I don't know how to do this. I don't know how to make it more like uh, organized. But this is how, that's the only thing I can do. That's the only way I can help you guys. So yeah, please message me and ask questions. Okay, thank you very much, and I'm gonna share this to the nurses, incoming nurses or future nurses that is following me and asking me, messaging me, uh, so that I don't have to yeah, answer separately. Okay, so and also it's like it's not really it's very unorganized. I'm so sorry, but yeah, just bear with me. Okay, nurses, good luck to all of you, and I hope you pass too. And just don't forget to pray, and pray, do your affirmations, think positive, focus on your study, know your contents, and and you're ready. Okay, and you deserve it. You will pass. Okay, just pray hard. Okay, God bless you and good luck. Bye.